Not all spinal conditions require an MRI. If we start in children, a lot of the scoliosis that we see, that is abnormal S-shaped curvatures in the spine that may arise in children or also in adult onset scoliosis, not all of those conditions require an MRI. In adults, not all back pain requires an MRI. Not all trauma may require an MRI. So if you get hit to the back and you do not have instability, you do not have neurological symptoms, you do not have a reason for the MRI clinically, there is no reason to do the MRI. An MRI does not take away the need for a good history, for a good clinical examination, whereby important signs and symptoms are checked for in your history and physical exam. And that is, and only at that point, where you're looking for something specific in the MRI, is when you should prescribe the MRI. So it is important to limit how we use this important resource, because an MRI costs money to the patient, it costs money to the system, such that that resource will be used by someone else who really needs it. So if we look at it in terms of the capacity that we have to do MRI in the country, if you do unnecessarily images, it will cost the patient and it will also cost the system. So we should examine our patients correctly, do an exam, and if there is an indication made for the MRI, then we can proceed to do it. MRIs are necessary in cases where we have neurologic deficits. That means that you're unable, either it can be sensory or motor. Sensory is the patient reporting inability to have a feeling over a particular area. Motor could be looked at in terms of weakness. So in patients who present with objective weakness and grade that weakness, we usually grade that weakness maybe from 1 to 5. So if you have demonstrable objective weakness, then this is a patient who may require an MRI. In trauma patients, and the patient has neurologic deficits, this is a patient who needs an MRI. In patients with back pain, and the patient has had inability to control their urine and their stool, this is a patient that requires an MRI. In children who have scoliosis, if you have abnormal reflexes, also in adults, if you have abnormal reflexes, this causes us to want to do an MRI. Karibu Apex. Here, we endeavor to have the right diagnosis and the right treatment plan for you, because the right diagnosis leads to good outcomes every time. Karibu Apex.